Hi, my name is Dr. Leah Culliffe, and I am a faculty member at MCPHS School of Optometry.
Hi, I am Dr. Greg Waldorf. I am the Associate Dean of Clinical Programs at the MCPHS University School of Optometry.
My name is Louis Frank. I am an Associate Professor of Optometry at MCPHS University School of Optometry.
I chose the profession of optometry because I wanted to serve the local and international underserved populations. And when I got to optometry school, I was able to accomplish the international part by joining SVOSH, which is Student Volunteer Optometric Services to Humanity. And I was able to go to Colombia on a mission trip, and we were able to provide eyeglasses for patients, around about 1,500 patients that week. So that was really fulfilling.
My personal favorite part of the job is I love working with kids, and I love kids that are difficult to work with. It's always sort of a challenge, and a fun challenge for me to try to get the examination information from them.
Undoubtedly teaching the students, watching their aha moments when I have a breakthrough where they recognize something that I have spent time teaching them and making them understand. Watching them apply it to patient care is a tremendous amount of satisfaction to me.
Every semester is a little bit different for me. In one semester, I could be precepting in the clinic. I could be overseeing, up to 5 to 6 students in primary care, treating patients at the community health center. I could also be helping in the clinical optometry labs, and also I could be lecturing. So that's one part of academia that I love, is that our job as an optometrist is very versatile, and you can do a whole bunch of different things.
It took me several years after graduating from optometry school to decide exactly where my specific clinical interest would be as an optometrist. So I had to go through some growth and development and soul searching in that context. Because some of those interests pose challenges to me depending upon where I geographically located or what clinical opportunities were available to me. So that sort of had to evolve.
Probably the proudest I am of a case that I work with is that I once worked with an 18-year-old boy who had snowed into a ski machine. And as a result of that, he had a very severe traumatic brain injury. So through the working with him with vision therapy, we were able to get him back to seeing single vision from experiencing double vision, and he was able to return to college the fall after we worked with him.
A case study of a patient I'm most proud of is probably when I was 3 years out into practice. I saw a 26-year-old male who came in because he was having problems seeing. And he was very vague about his complaints of blurry vision. He said, Doc, I know that I can kind of read the chart good, but it's still blurry and I can't explain to you why. Well, with further questioning and further probing and doing more and more diagnostic testing, I was able to diagnose him with a small benign pituitary tumor. And because we caught it so early, he was able to have surgery and his vision returned back to normal 20/20 vision with no complications. That was a very rewarding moment because we study really hard in optometry school, and sometimes you think, am I ever going to see this? And guess what? You will, and you'll be prepared to diagnose and treat that patient.